Good evening, everyone. I'm just going to walk you through federal government transfers with a focus on healthcare. And the reason why I'm focusing on healthcare with this brief presentation, because there's a lot of discussion going on during the election campaign in Canada in terms of what government's going to support and continually fund healthcare, because each party is going to try to tell you their own position in terms of what they're going to do with healthcare. What I want to illustrate here is a couple things with this. And I want to show you that basically what's happened in terms of the transfers since Stephen Harper took office and what the commitment is on healthcare past 2017 as part of a new deal that they're working with the provinces. So let's look at healthcare dollars, okay? So you see a line down there that says healthcare transfers. In 2005-2006, when we transferred healthcare dollars, we transferred them basically at $20.3 billion. So basically, since 2006, at 2006, our baseline healthcare dollars was $20.3 billion. If you look at 2015 to 2016, it's actually going to $34 billion. So healthcare actually almost has doubled the amount of money since Stephen Harper took office, coming into 2016. So when somebody tells you healthcare has been cut, it hasn't been cut by the federal level. Stephen Harper continues to fund healthcare dollars at 6%. Now, in 2016-2017, Stephen Harper is actually going to change the rules. He's actually going to go to a new formula. He wants funding to be sustainable. He wants it tied to GDP growth so that when going forward, the funding is sustainable. So basically what the goal of Harper is that minimum health care we'll receive is 3% of GDP. Now if GDP grows faster, he will adjust that revenue to the provinces based on that. So that's what you're not told. Now, a lot of things you're going to hear as part of this campaign is you're going to hear about a $36 billion deficit in funding. Well, there was a survey done by the provinces by the Council of Canadians. And let me give you a brief background of the Council of Canadians. They're a group that's a left-wing think tank. They have mostly NDP people that were involved with the Council of Canadians. One of the key members, a former director, is an NDP MP named Peter Julian. Peter Julian was a director on the Council of Canadians. Does it only make sense, since Peter Julian was connected to the Council of Canadians, that the NDP would likely use that report? And that's what they did. They used that report to basically say they need to put more money into healthcare. The report never looked at different aspects of healthcare in terms of efficiency, the waste that's been done. We could go into situations in Ontario where they've blown billions on e-health. We've got situations where the LHINs themselves haven't been efficient or effective. They've just created another layer of management. We can go into different aspects of funding itself that basically the government has cut funding to hospital or kept it at 1% when they actually got transfers to 6%. So who's really helping the hospitals? WIN's taking that money and transfer to keep the size of her government. But you don't hear that. You don't hear about the provinces have gotten together in terms of the procurement cycle. Don't hear about that. So all you hear about is Stephen Harper's basically cut funding. Stephen Harper gives money to the hospitals to run healthcare. That's how it works. That's the role of federalism. That's how the taxation processes work. How the provinces go about delivering bang for your buck is up to the provinces in terms of healthcare. Basically, I want to give you an example where the money's spent. Hospitals itself. So that's the hospitals you go to for emergency care. Represent about 30% of the dollars. Okay, so the operations of a hospital, and they're phenomenal in size, because you got to remember, you got the administration there, you've got hospital beds, you've got radiologists, you've got a different crew to basically support people, from extended care in there or overnight stays. That's all part of it. Spending on drugs. Now this is getting into anything that's to do with pain pills, different things, is another 16%. Spending on physicians. Now this is the salaries. This is the labor cost at a hospital. You're paying doctors good money, and that also has to be controlled. And that's about 15%. The next chart I want to show you is the growth of healthcare dollars. it's shown in two reflective ways. One is the current trajectory based on the funding in terms of the total healthcare expenditures up to 2013, and you can see we're above $200 billion now in healthcare. The next one, which is showing you more of the square line, is showing you in 1997 dollars what have we done. So there's a gap. So we're actually, based on if we're paying the same rate in dollars, we're paying less than we would be under the current system. So that's really what it's showing you there, the gap there. So we're actually doing better in terms of how we're funding it between the 1997 dollars and the actual. So if you look at in the 90s, we actually cut back healthcare because of austerity measures. That's what that graph is showing you. Where gradually in 99 and 2000, Paul Martin put money back into healthcare after starving it close to a decade. The next chart shows you where healthcare was as a percentage of GDP. Look at where it was. In 91-93, it was close to 10% of GDP was tied to healthcare. Now look at where it is now. It spiked up to about 11%. It's come back down because the GDP is probably growing at a faster pace than what we're growing at basically in terms of healthcare dollars, in terms of what we're required as expenditures. This one gives you kind of a breakout in terms of where the expenditures are happening. 93% of healthcare spending is done by provincial territorial governments. There can be some specific funding by the federal government that can be self-directed based on programs, based on initiatives that can come into play as part of supporting that. They could be one-off programs, or they could be programs that they will continue to provide certain funding for healthcare, or they could be programs that they may botch or may not be required. So these are the type of programs that they'll bring in. Municipal governments could be involved as well in terms of providing some donations or other sort of funding to help hospitals survive. Let's talk about now total healthcare expenditures per capita. Now, on average, Canada spends per capita of about $1,773. Now, look at this in terms of the provinces. Alberta spends, on a provincial level, spends about $2,379 per capita. So their healthcare expenditures are a lot higher than other provinces. Ontario, which has a large population, their per capita spending is down. But look who's the lowest one in Canada. Quebec has the lowest per capita spending on hospitals. Okay, so I wanted to bring that into play. Now you can just look at the different ratios on physicians. The lowest pay for physicians as an expense, or for physicians, as you get into the territories. Ontario pays a higher rate in terms of physicians, which makes sense because of the urbanized environment and the cost of living in Ontario. And then you basically just seen some other graphs here. Let's talk about LHINs now. When the government of Ontario was elected, as part of their mandate, they took over from Mike Harris. Basically, they decided that we needed to create better administration of hospitals. So when you hear, as I said earlier, about the Parliament Budget Office report or the Council Canadian Joint Report, it never discussed about these departments being created. So all the money used to be handled through the Ministry of Health at various provinces, including Ontario. All of a sudden now, with your starving a system with money, you create another level of management, which means that dollar now is going to be tied up in the bureaucracy. There was no real initiative to kind of improve the delivery. It was saying we need another level of management to make approvals. When you deal with NDP or Liberal type of governments, you're dealing with, they believe a solution to a problem is throw money at it. They believe you add more headcount. Conservative governments typically look at more efficient, effective ways to deliver things. They want money in the hands of the people to do it. So a conservative government at a provincial level likely would have taken the money and given it directly to the hospital and put more accountability in the Ministry of Health to monitor outcomes. But that's not what happened in Ontario's case. They created a level of government which now takes a system that's starved and took money away from it. Now, I want to illustrate this chart here, because it's a good chart to look at in terms of efficiencies of health, because I've always stressed that. Yes, you need to make sure funding is proper, but you also want to make sure you bring in innovation on how you deliver healthcare, how you manage those precious dollars. Take a look at who's the best country in the world in that. Singapore. Singapore, per capita, if you look at their rating, their score is 78.6. Canada's ranked 21. Now, you're going to say, oh, that's all Stephen Harper's fault. How is that Stephen Harper's fault? He provides funding. He doesn't provide the resources to deliver healthcare. That's the provinces. So if Canada's dropping, that's likely to do with the provinces doing poor delivery. One of the worst provinces in Canada is Manitoba. Manitoba got a D rating in its healthcare. Guess who runs Manitoba? Manitoba is run by the New Democratic Party of Canada. Thomas Mulcair never talks about Manitoba NDP. Why? Because they're a disaster. They've got high debt, they're on Moody's rating, and they've got a poor healthcare system. Okay? He doesn't talk about that. He also doesn't talk about the waste in healthcare, because he has no control over it, so he basically shuts up about it, which is fine. As a leader, he does that. But you can't turn around and blame Steve Harper in healthcare if you say it's starved when you don't look at the people that are delivering it. And that's the problem when you deal with Justin Trudeau as well as Thomas Mulcair. They blame Harper for every problem, but they never once called the provinces. And that's fine, because they play this game of hide and go seek and don't want to talk about it. Now let's talk about party policies here. The NDP will take that $36 billion report and put healthcare dollars back up to close to $4 billion a year. The Liberal Party Canada will do the same approach. Harper will tie it to GDP growth of 3%. So, let's take a step back here now. Now, you've got $4 billion more promised into healthcare. Where's that money going to come from? Well, there's only one taxpayer. He's either going to hike corporation tax, hike personal taxes, hike GST, but he's going to have to find the money to fund that, right? He hasn't come clear. None of the parties, like NDP or Liberal, have come clear on how they're going to fund these additional expenditures. The other thing you need to ask yourself, take a look at yourself. Take a look at your healthcare system. Who has responsibility to deliver healthcare? The provinces. All Harper has the responsibility to ensure it's funded. And that's what he's doing. He's ensuring that money is growing each year to healthcare. So if you want to have problems, I suggest you take a look at your individual provinces and see how they're doing in terms of delivering healthcare.